the trumpet, trusty watchman. Blow it loud o'er land and sea. God commission, sound the message. Every captain may be free. Sound it for the heavenly dead, weary longing to be free. Sound the Savior's invitation, sweetly saying, come to me. Blow the trumpet, trusty watchman. Blow it loud o'er land and sea. God commission, sound the message. Every captain may be free. Amen. Thank you very much. And we have quite a few presenters, so I would not want to take up much more time. So, to take another song then. All right? Is there a selection at this time, please? 512. Thanks for that selection. Yes. After the singing of the same, then we'll have. It has 4 standards. All 4. Just when I need it most. Just when I need him, Jesus is near. Just when I falter, just when I fear, ready to help me, ready to cheer. Just when I need him most, just when I need him most, just when I need him most, Jesus is near to comfort and cheer. Just when I need him most, just when I need him, Jesus is true, never forsaken all the way through, giving for burdens, pleasures anew. Just when I need him most, just when I need him most, just when I need him most, Jesus is near to comfort and cheer. Just when I need him most, just when I need him, Jesus is strong, bearing my burdens all the day long. For all my sorrow, giving a song. Just when I need him most, just when I need him most, just when I need him most, Jesus is near to comfort and cheer. Just when I need him most, just when I need him, he is my all. answering when upon him I call, tenderly watching lest I should fall, just when I need him most, just when I need him most, just when I need him most. Jesus is near to comfort and cheer, just when I need him most. Thank you very much, my brothers and sisters. And at times, the question is asked, is there a doctor in the house? We are so fortunate today. We have many doctors in the house. At this time, I'll ask our pastor to introduce them. Please, Pastor.
All right, we are privileged to have with us a group of Seventh-day Adventist physicians who have committed and dedicated themselves to the healing of God's people, and it comes to education and information, and they avail themselves to be here today. It is a wonderful privilege, and so I'm going to ask Dr. Daniel Moniz here to come forward and to lead the charge in this endeavor. I don't know if you want to sit over here.
Yes, thank you, Pastor. Good afternoon again, church. Something I forgot to mention this morning is just that we also go abroad. We go to other countries and do medical missionary. We used to go to Haiti every year after the earthquake. And with what's happening right now with the kidnapping, it's kind of dangerous. We don't go anymore, but we go other places where we can find Haitians to help them out, or Jamaicans, whatever, because the pastor's planning for us to go to Jamaica. He's planning for us to go to Jamaica next year. As a matter of fact, our president just came back from Punta Cana last Monday from medical missionary. So what we do, we went to Puerto Plata 2 years ago before the pandemic, 2 years ago. And what we saw, it was horrible, okay? It was horrible. And we are going to, in February, we are going to the Bahamas to help out the Haitians. Anybody who anybody wants to come, you are welcome. You don't have to be in health. You can help with a lot of other things. If you're a physician, a nurse, a social worker, a dietitian, whatever you are, you're welcome to come and help us out. We will be leaving on February 18th to the 25th. We always go on a weekend where there's on a week where there's no school. Okay, that would be winter recess. So we do these things for free. We don't ask for any money for these programs that we are doing. All we ask for the church or the members is to pray for us. That's all we do, okay, is to pray for us. And that's what I wanted to mention this afternoon. If there's anybody who's willing to come or to help with the trips, you are welcome, okay? Yes, this afternoon we're going to be talking about mental health. It was, when I asked the pastor yesterday, was it Thursday, Pastor? We talked Thursday, right? Yeah. I said, Pastor, what would you like us to talk about? He's a theologian. He said, whatever you want. And when I asked Sister McGinnis, who's in health, she said, mental health. Right there, she had an answer for me. So we're going to be talking about mental health this afternoon, but just like I said this morning, the questions don't have to be about mental health or behavioral health. It can be about anything, any kind of disease, because we have an infectious disease doctor here, family practitioner here, so we have a social worker here, whatever it is. Even if he has, and we have a principal here, Miss Principal, yeah, in education. And we also have 2 nurses in the back. So whatever it is that you want to ask, please feel free to do so. At this time, we're going to bring Dr. Ulrich to speak to us. He's going to cover depression, anxiety, suicidal, and schizophrenia in one. Okay, let's give him a mighty amen. Amen. Thank you.
Good afternoon, everybody. We want to thank God for the opportunity that we have to be here together. We want to thank the pastor, the elders, board, the board of the church, and all the members for inviting us today. We are going to talk about mental health. It's a lot that we are going to cover, but we are going to talk quickly, and then when we have the question, when the time for questions, you can ask questions. Okay, so when we have a psychiatric patient or mental health patient come to us, so we have to see the appearance of the patient, grooming, if the patient dressed well, if the patient take shower, patient is well kept or unkept. We see the facial expression, the eye contact, and patient with depression, they don't make good eye contact. They put their head down. We have to take in consideration the cultures also. Some people, they don't look at you in your face, okay? And the motor activities and patients with depression, they have a tendency to be very slow, okay, and moving. The postures, people with schizophrenia, they have some posture, catatonic postures, and sometimes they are restless. And the appearance, if they look at the chronological age. And we see the affect and the mood. The mood is the patient is telling you. The patient will tell you. How do you feel? How is your mood? The patient will tell you. The affect, you will see the affect, okay? And then we have to see the mood and the affect, they match together. They're supposed to match, okay? Yeah. It's like if I tell you I'm happy, and my face is like that, so I'm not happy, right? Okay, and then if the patient has normal mood, the patient is depressed, the patient is agitated, is hopeless, etc. So we ask the patient, when we talk to the patient, we check the speech, how the patient talk, and the content of the speech, the content, we check that a lot. If it makes sense or not, coherent or not, okay? And if the patient is goal-directed, if the patient is linear, goal-directed, if the patient is tangential or circumstantial, let's say the patient is talking about something and they put a lot of nonsense in it, and then we have to cut and then get exactly what you want. They have flight of ideas, like bipolar patient, they talk, and then non-stop. Okay, if they are blocking thought, like depressive patients, they are blocking thought a lot. They confabulate, schizophrenia confabulate a lot, distracted. Bipolar patients tend to be distracted a lot. Okay, schizophrenia, they mumbling to themselves, they talk to themselves. Okay, hallucination. They have problem in the perceptions. So these patients, so they see things that we don't see, and then we have to reorient them. So we have to tell them that we don't see what you see. We don't see it. So it's not true what you see. And then the most common one is auditory hallucination. So they see things. Then you have visual, olfactory, gustatory, and tactile. People, when they use cocaine, they have tactile hallucination because they have like something under the skin. They scratch a lot. They are like that. Usually that's how they present. That's cocaine. Okay, delusion. Delusion is false fixed belief, meaning what the patient is telling you is not true. It's not true. But they see something, but they cannot interpret it well. Okay? For example. Okay? So they can be grandiose, schizophrenia, bipolar. Bipolar can be so grandiose, they can tell you that there's a patient who came yesterday, she said that she knows the General Attorney. She has been working with General Attorney for years. I don't even know if she knows the General Attorney's name. Okay? and persecutory, somatic, religious, they can say that they are Jesus. They come to earth to save people. They can say a lot of things. Okay, nihilistic, they are very negative. And then erotomanic, meaning that somebody can be here, a patient can be here. The patient can say that these women love him, while they have no contact, no relationship, nothing. Okay? Next. Okay, depression. We have a lot of people with depression in this country. Okay? Especially after COVID, that's when people open their eyes on all of these things. Okay? People kill themselves a lot. A lot. Okay? So the depression can be for many causes. For example, chronic diseases like diabetes, hypertension, heart disease, all of these could be social issues. For example, problem with rent, problem with job, economical problem, financial situation, or sometimes it's important that when they had problem in their childhood, they have been raped or anything like that. So they come up with depression. Okay? So we ask them about how do they feel in terms of the mood, the affect, if they sleep, okay. A patient should sleep like 6 to 8 hours, the average. 5 is okay, but if the patient doesn't sleep well, like sleep for 2 or 3 hours, you know that the patient will not be able to concentrate, to stay focused, to do anything during the day. We ask if they have problem falling asleep and staying asleep. Falling asleep, you go to bed, and then in 20, 30 minutes, you're supposed to sleep. Okay? So staying asleep, so they wake up early in the morning. Early in the morning, that's a sign of depression. Early awakening, depression, okay? When they have fallen sleeping, meaning they are stressed, anxiety, they are thinking about it. They have raising thought, they are thinking about a lot of things, so they cannot sleep, okay? So before we continue, there is something that they call sleep hygiene. Sleep hygiene is for everybody to do. It's like you sleeping, no cell phone. No cell phone for 1 or 2 hours. And then no noise, okay? No TV, nothing. Try to get rid of the TV little bit before you sleep. Don't sleep during the daytime. Don't sleep during the daytime, okay? You sleep during the nighttime. If you sleep during the daytime, you are going to have problem to sleep during the nighttime, okay? Unless there is something special, right? Okay. So when the patient is depressed, they have problem with energy. They have low energy, or they feel tired. They move very slow. And they eat a lot. Some patients eat a lot. Some patients don't eat. Okay, it depends. And one of the things we have to check is suicidality. And this patient, when they are depressed, they have tendency to kill themselves. And we have to check on that, okay? That's why church is important that you check the members. You check your friends to know how they are, and then so you know when they have a problem. You don't see them one Saturday, you call them. Okay? And you call them, you don't find them, you go to the house. Because a lot of people die in the house. A lot of people die. Okay? Okay, so they kill themselves. So between men and women, men kill themselves. If a man say that he is going to kill himself, he will kill himself right away. Jump off the bridge. If the woman say that she's going to kill herself, she will go to Brooklyn, talk about it, and return to centralized sleep, and then go to Connecticut, and then do a lot of things before the woman. Exactly, go shopping before. So the woman will talk a lot and will do something so she can be saved. Okay? The same thing, you can see two men fighting in the street, they will not fight really until somebody come to separate them. All right. So men, when a man tell you he will kill himself, he will kill himself. Okay, and they have certain things they say. You have to be careful, pay attention on what they say. If you see somebody making plan now to have a will, I don't say that it's not important to do. Okay, now they are making plan to have will. Who is going to be responsible when they die? Things like that. That is questionable. Okay. All right. Okay. So when you see somebody with depression, you have to help the patient to get support. Okay. The patient can go first to the primary care doctor. The primary care doctor can do all of that. Can start to give some medication, and then they refer the patient to the psychiatrist. Okay. And we have to have a balanced diet, all of that you already know. And there is a suicide line, and then you call. Or, I don't know, in Nogalen they have 311, right? You call 311. It's easy. 311, 911. You call. If you know somebody is going to kill himself, 311, 911, they come right away. Okay? Okay. Yeah, so if they have plan, when they come to the hospital, you ask them if they have a plan. Sometimes they tell you, I want to kill myself. A lot of patients, they are maligners. Okay, they come for secondary gain. They come to sleep in the hospital. And the hospital is not for sleep. Okay? And now we have problem with a lot of immigrants come, right? And then we have a big problem. The mayor told us that to keep the patient in, and we cannot push them back out. But anyway, it's very conflictive, right? Okay, so if they have plan, and then if they tell you they have plan, so now we put them in one-to-one, meaning someone is going to watch them 24 hours, okay? And if they may have plan, but what is the plan? So what they want to do? If they say that they want to jump off the bridge, meaning they don't have it in the hospital. So it's outside, but they are here in the hospital. Sometimes they are not going to do it really. If they tell you whatever they get, they will kill themselves, then it's important because they have the knife in the hospital, right? The knife, the plastic knife, they have all of that. Or the sheet that they use, they can tie their neck and they die. We have patients, they tag the neck and they die in the hospital. So that's why we have to watch them a lot. Okay, so if the patient has past history of suicide, they can do it again, okay? So we have to take that into consideration. If they use drugs, they have at risk to kill themselves. Marijuana, cocaine, all of these, they have at risk. If they are teenagers, they are at risk also to kill themselves. Okay, once a teenager come to you, we put them in one-to-one, quick, because they are more at risk than anybody else. Homicidal, if they want to kill people, to kill somebody else, we have to ask who it is, who they want to kill, and we have to let the person know. Let the person know, okay? And we have to know if they have weapon, what do they have, how they're going to kill the person, and then to let them know. Okay, so we know that a human being is not about physical, only about spiritual. Spirituality, it's everything, like the eighth dimension of health. You understand that? Eight. It's everything, not only one. Okay, so when COVID came, so people had a lot of problems because, when somebody die from COVID, they burn, they burn the body, right? And so a lot of us, we know by culture, they have to bury the person, right? So when they burn the person or in the hospital, you can't even find the person. You don't know what happened. And then all of that put the person at risk for anxiety, depression, because these people stay with like they never heal inside. Because we know that we do the funeral and we know that that's it, right? But these people, they didn't do anything. So it's a really problem. It's really a problem. Okay, next. Oh, okay, stress. We know that we need stress to function, right? But little stress enough to do what we have to do. But when it's too much, that become anxiety, and then that's when the problem comes. So stress is something you deal from outside. Anxiety is inside. Anxiety, we have like 4 steps of anxiety. The first step you can manage, and then the first level you can manage, but the third and fourth level, you need to get treatment. Most of the time, they give you a medication and therapy. Somebody needs to talk to you and to see exactly what is the problem, and then they can deal with it, and then you will be okay. Normally, the body, there is a part in the brain they call it's called amygdala. When people are in normal stage, the amygdala control everything. But when there is a stress or anxiety, the amygdala and then give order to the hypothalamus to give a signal to release hormones. And then the hypothalamus send the release to the hypophysis. Then the hypophysis go to the target organ, the adrenal gland. So then the adrenal gland has to stop. That's what the amygdala does. But in a situation of stress, we cannot do that. The body cannot do that, and the body keep producing hormones, the stress hormones. So then that's what we have problems with the neurotransmitters. So too much hormones in the brain and the synaptic cleft, and then keep stimulating the body. Stimulating the body too much, that's when we have problems. Next. Okay, we talk about that next. Okay, let's talk about schizophrenia to finish. Schizophrenia is a severe disease, chronic severe disease. At least you have to have 6 months with the symptoms. Okay. We have like negative symptoms and positive symptoms. The positive symptoms, it's like delusion. We spoke about delusion before. False fixed belief, right? And then we have disorganized thought. This patient have disorganized thought. What they say, you see, when we talk, it's well organized, right? What we say. But them, they have a problem in the brain. They have poor insight, so they cannot organize what they say. They are not able to do that. So disorganized speech, disorganized behaviors, and then delusion, and then paranoia, all of this, and then suicidal, all of this. So and hallucinations. That's the positive symptoms. The positive symptoms they are better than the negative symptoms. The negative symptom, like put the patient like flat affect. The patient is withdrawn, isolated, stay in the room, doesn't interact with, with other people, okay? So these two symptoms make the symptom for schizophrenia. Schizophrenia is very frequent. Or men and women can have schizophrenia. Men have schizophrenia before women. Men at the age of 25, women start at 35. But when a woman has a schizophrenia before that age, it's severe. It's severe in the woman, okay? Okay. People with schizophrenia have the tendency to kill themselves at 50%. But 10% of them reach the goal to kill themselves. Okay? All right. Then, what happens with schizophrenia is when they do study in the brain, they see the frontal lobe that take control of everything shrink. It's a little smaller than the regular people, right? Also, there is something that they call synaptic pruning. Synaptic pruning, it's an ability for the cells to communicate between each other, right? It's like the same thing me and you, we are communicating, right? So the cells in schizophrenia patients, they cannot communicate between each other. So it's very bad. So that's why they have so many problems, okay? So then we have medication for these patients. So a lot of times they don't take the medication because of the side effects. The side effects include diabetes, hypertension, all of these, including also what they call EPS, extrapyramidal side effect. For example, last time we had a patient who just get Haldol, and then the patient start to have her neck stiff. She cannot talk. That's what they call acute dystonia. So we have to medicate the patient, give Cogentin, or we can give Benadryl. We prefer to give Cogentin more because the Benadryl is going to make the patient drowsy. So we need to assess the patient, we give Cogentin. So we have a lot of medication, but they have problem with the weight, all of that, diabetes, hypertension. So that's why the patient, they don't want to take the medication, okay? And also because they have poor inside, they don't want to take the medications. So that's why we have to help them. Family members, friends, they have to help them to take the medication, okay? So the more they do drugs, the worse they are going to be. If they do drugs, they are going to make it worse. That's when they relapse, okay? And also, a schizophrenia patient, they function very well. They function very well. How many schizophrenic patients we can have in the street? We have a lot of them in the street. You have a lot of them at work, yes? You have a lot of them at work. They function very well with medication. Once they stop taking the medications, that's when they have problems. Okay, when they start doing drugs, that's when they have problem. Also, this patient, when we discharge them, some of them cannot do certain type of jobs. So they send them in certain places where they can help them to have some skills so they can function. They can function well in the society, so they can work, they can do what they have to do. Okay, so I'm going to stop now, and then we are waiting for the question. I don't know if you want to say something. Okay, now you can ask question about anything. anything in general, diabetes, hypertension, heart problem, psych problems, infectious disease, everything, COVID, everything, okay?
But let's do it in an orderly fashion. If you want to ask a question, just raise your hand.
Moderator that can
Somebody
really
to-
control.
To moderate.
Yeah.
We want everybody to raise their hand at the same time, and then
Pastor, you have a moderator, somebody that can. Yeah. Okay.
I will do that. We have extras.
and the question does not have to be only on psych. It can be from any subject
All right.
that you want to ask.
So I'm going to ask everybody to kindly stand. Stand for a moment. Stand for a moment. We've been sitting for a while. They say sitting is the new smoking. So we're going to ask everybody to stand. If you need assistance to get you standing, we will help you. Thank you very much, Sister Grace. All right. Okay. All right, you may be seated.
Before we start, the nurses are doing vital signs outside, just in case if anybody wants to be screened.
All right.
So.
If you want to be screened and you want to know your numbers. All right. Any questions for the doctors?
Or not.
Okay. One question over here. Okay. All right. There's a question here.
Thank you. Is being schizophrenic is the same as being bipolar? All right, so what's the difference?
Okay. The difference is schizophrenia and bipolar. Okay, schizophrenia, I told you. The symptoms are hallucinations, so problem in the perceptions. Okay, hallucination, delusion, false fixed belief, and disorganized thought, disorganized behavior, and the flat symptoms, the negative symptoms, isolation, apathy, avoidance, meaning the patient doesn't want to do what me and you we do usually. Okay, that is schizophrenia. Bipolar, it's like different. Bipolar is like that's what they call it, bipolar. Sometimes they are up, sometimes they are down. Okay, one of them I'm going to start with the hypomanic. Hypomanic, it's when the patient can be in the street working fine. There is no need for hospitalization, because hospitalization, unless the person cannot function socially, the person cannot function at work, in the house, or wherever the person is functioning. Okay, the person cannot do it well, so they have to hospitalize the patient. Hypomanic, you don't hospitalize the patient. Manic patient, that's where people say that bipolar, manic, they're more familiar with manic. Manic, there is something they call dig fast. The D for distracted. They are distracted. The I, like, okay. The G for grandiose. A bipolar patient can spend $10,000 in one shopping. One shopping. Then what will be the problem after? The problem will be with the family. That's why bipolar patient, they get problem with relationship, because if you as wife, you spend $10,000 at Macy's and one shopping, the husband will not accept that, right? Vice versa, right? Vice versa.
Unless he's also bipolar.
Exactly, Pastor. Thank you, Pastor. And also, flight of ideas. Bipolar will talk precious speech. Okay? Bipolar also they are hypersexual. Hypersexual means they can be in the unit, they can pull their pants down, and they can invite anybody to have sex with. Okay? So they don't care. It's not they don't care really because they have poor insight, right? So that's bipolar. And then they are hyper in the unit. They are all over the place. They don't sleep. They don't sleep. They can spend like days, weeks, they don't sleep. And then that's why they have to come to the hospital. If not, they will crash. They will crash. If you don't sleep 2 weeks, please, you cannot function. They will crash. And then bipolar, they have a lot of infection because they don't care about they don't care about STDs. I'm talking about STDs. If it was for hygiene, but STDs, they don't care who they deal with in terms of sex. Okay, that's bipolar. It's completely different. The medications, they are completely different. They are completely different.
So is it?
Can I add something?
So they.
As the name suggests, bipolar, there are two poles.
That's right.
One poles, they are hypermanic. Sometimes they think they're superhuman. They can do everything. They don't sleep. If the woman, they are having sex nonstop.
The nymphomaniac?
Nymphomania,
Yeah,
yes.
nymphomania.
And then the other pole, the crash, they feel so depressed, they don't want to do anything. Okay? One pole, they are depressed, they don't want to do anything, they don't care about themselves. And the other pole, the hypermania, they feel superhuman, they do everything. They're so energetic. Okay? So that's why they call it bipolar. One pole is super active, one pole is the crash, they're down. Now, in terms of schizophrenia, there are different type of schizophrenia. Some people are schizophrenic, they are they're paranoid. They think everybody is after them to kill them. And some of them, they feel grandiose. They think they are the president. And they have so much money.
That's Trump?
Yeah. And then nobody can tell them anything. They feel they're great. Okay? And then the perception is a little different. For example, someone who is paranoid, you can see somebody coming to them. They think this person is going to kill them. That's why sometimes schizophrenic people can kill people. Because you're coming to them, they think they're going to attack them, they attack you first. So at the different type of schizophrenia. Grandiosity, paranoia, and etc. So these are the two different between bipolar and schizophrenia.
All right, there's a hand at the back. Ben? Stand up, Ben. No, go ahead, Ben, please.
Chronic stress and
As we said before, the stress that you need the stress to function. But when it's too much, so you have to be able to see when it's too much and then to slow down. Also, you have to know what make you stress to control it.
Is that stress, Doc, or is that distress?
Huh?
Is it stress or distress?
Okay. And so now, chronic stress is a problem, okay? So that can lead to depression.
Yep.
That can lead definitely to depression, all right? Dementia?
Dementia.
link between.
Talking about dementia and stress?
Yeah, he's asking if there is a correlation between stress and dementia. If stress
Okay,
is
so
a cause,
he's
then
going to answer, but we
Okay.
have... Okay, go ahead.
Basically, there's no direct relation. However, if somebody is stressed all the time, your pressure can increase,
Yep.
and then you can get what they call mini stroke. Okay? So there's something called multi-infarct dementia. If you have a lot of mini stroke, this can damage your brain, and it can cause you to have dementia. You forget things. Okay? So stress can increase your pressure. If you're already somebody who is already hypertensive, and give you multiple infarct dementia. Multiple strokes lead to dementia. But is the stress directly cause dementia? There's no, scientific studies that prove that. But you can say somebody who is stressed with hypertension, and then if you develop multi-infarct, then you can develop dementia.
So correlation is not correlation does not lead to causation.
No, the stroke, because when you have multi-infarct, there's a lot of tiny infarcts in your brain, then you can develop dementia. There are people who have high blood pressure, who don't have stress, yet because they have multi-infarct, they develop dementia because of that.
A question over there. Huh? Okay. Well,
Well, you see, okay, the thing is, a lot of diseases that exist in the past, we don't hear about them because right now we're living in an era of technology, social media, science, everybody talk about everything. Okay? So they may have in the past a lot of people with dementia, then we didn't know it. But now we pay more attention to this.
so is Google making your job more difficult or easier?
Well, in a sense, yes, because a lot of people get false information from Google. Because everybody wants to be that.
Yeah.
They put the information what they think it is, without even proving it. They say it, and then somebody who has a tendency to believe whatever the person says. They just grab it and then spread it.
See, you have to know which site to go to. Like, for instance, if you go to WebMed, it's legit. Okay? There are certain sites. Mayo Clinic, it's legit. CDC, it's legit. Cleveland, it's legit. So you have to know. You just cannot open it and go to anything. Because you will be misled, and you will mislead other people by telling them. Because everything that they hear, without even checking, they will start spreading it. And that's how we get all these problems with when we had COVID, the type of comments that you heard, oh, you're gonna turn into a monkey within a few years, this is gonna happen, you're gonna do this within a few years. That was misleading, okay, because we didn't go to the right side. Everybody, during COVID, everybody became a doctor. Everyone. There was a pastor who said that he would rather die than taking the vaccine due to the fact the vaccine is gonna change our hormones into female hormones, whereas we'll start developing hair and female will turn into male. A pastor who's supposed to be well educated said this thing on while he was preaching, and which is on YouTube where everybody's listening and hearing him. No, I know who I'm talking about.
He said he died.
No, he didn't die.
Maybe
You're talking about somebody else. I'm talking about
person.
somebody that I know who's pastor. He's a Seventh-day Adventist pastor in Florida, okay? So very well educated. Okay, he used to work for the Northeastern, not anymore, but he's in Florida. No, that's not So we have to be very careful about what we hear and what we say and where to go to find information.
Anybody can post some information.
Anybody. We have no what?
You need to use the mic
Get the
because we're not
microphone.
hearing you.
Yeah, there are always risk factor in anything. There's always risk factor. But yes, anything. For example, most of us here, I think most of us didn't born here. We were born in different countries, and the way of life is different than here. And then there are people, for example, in my practice, I have patients always complaining of insomnia. They cannot sleep. And then, okay, I say, you don't cannot sleep. And I explain to them, I mean, what is your way of life? What do you do? And then they say, okay, when I go to my country, I sleep perfectly. But when you come back here, insomnia. Because you have a lot of things. Person is working. Some of them have two jobs. They have bills to pay. Well, it's not only globally. For any industrial country, is the same thing. You will see any country that people is so industrialized, is the same thing happening. If you see in Europe, probably it's the same thing also. But in our country, okay, for example, when it's some people live in the countryside, not enough light. When it's 6, 7 o'clock, they go to sleep. Okay? But here, and then when you stop sleeping, and then you hear the how do you call this, big siren everywhere, so you cannot sleep. So yes, your environment do that. Okay? Yes. Yes.
24 hours. It's true though, the city of man.
I wanted to ask a question about anxiety. What do you do when children have anxiety? How do you go about helping them? And, when it's really bad, I know someone with, really serious anxiety, and she's like 12, 13, and she's really having a difficult time, socializing.
So first, you probably have to find out what causing the anxiety. Most of the time, the anxiety is causing by something. If you can find the reason that causes the anxiety, some people, they may be afraid of, let's say, going to school, they're bullying them, or they're going to have an exam, or they're afraid their parent is too severe. Everything they do, somebody's blaming them. So try to find out the root cause of the anxiety if you can alleviate them. But sometimes it's hard. Sometimes teenagers doesn't want to talk to you. They don't want to tell you what the problem is. And then...
Yeah, but this person I'm talking to, she experienced anxiety at the age of 5.
Yes.
And how do you identify the root cause if they can't really explain why they're feeling the way they're feeling?
Yeah, sometimes you can observe them. And then if it's not, then there are child psychologists or psychiatrists also. You can, I know some people doesn't want their children to go to psychiatrists to label them as a young age. But if this child is so anxious, having problem, then you need some professional help. Then again, the child may not tell you what causing the problem, but if you observe them, you may find the reason. At school, either there is a problem at school, at home, or something. If you cannot find it, then you try to find a professional help.
Yes.
And then you can start the conversation with the PCP.
Yeah.
The primary care provider, that's the person to speak with, and then they will guide you. No, I think they heard me. Yes, so the first person to speak with is the PCP, the primary care provider. Explain to them that, okay, this is what's going with the child, and you see some changes with the child, and then they advise you, to see whoever might be able to help the child. Yeah, you can speak with the guidance counselor at the school too, to find exactly what's going on. Speak with the teacher, the principal, the assistant principal. All these people can tell you exactly what's going on, and with that, and you can find exactly what to do to help the child.
Okay, we've done the psychology part, the counselor, the school psychologist. We've done the gamut of trying to find out what the problem is. Now, the only other thing I'm thinking, is it possible, could it be the diet of the child? Because we did the psychologist, we did the counselor, we did the teachers, we modified her schooling so that she's not in with the crowds and so forth and so on, but she still experienced serious anxiety. And they weren't able to give us any answers as to why, till eventually she says, I don't want to go anymore.
Okay. Also,
Yes, I've been doing the praying.
um, we have what they call psychosocial. When the patient come, we talk to the patient expensively in the clinic and to find out what happened. But sometimes something happened in the childhood.
Yes.
Something happened in the childhood, I'm telling you. And in this case, the parent at work, they don't know anything. The child cannot say anything because they are three, they are two. And then according to theories of depression, anxiety, almost the same theories, something may happen in the past. And we cannot know because only God can tell you.
Listen.
Only God can tell you. Okay? So now, based on the age also, they start with these drugs now. That can make it worse. Or maybe drug can be the one provoking this situation. Okay? They have what they call edible marijuana now. That's the candy. I have two patients who came to me, and the guy has anxiety. As a matter of fact, he's 20. He has severe anxiety. We discharged him 2 days ago. Last time I worked, after 2 days, he came back. He came back, anxiety. Could be something genetic related to depression, anxiety too. Okay? All right. So this marijuana issue, the K2, and then that's why I always tell anybody, don't eat like candy. People give you some candy, don't eat it. Give you food, don't eat it. It's not because you're paranoid, no. You try to prevent things, okay? So something may happen. Could be rape, could be anything like that. It would be beat up, abuse, physical abuse. And then that, you can dig a lot, you will never know because nobody can tell you. The best answer is we keep praying, then you go to heaven, God will tell you what's going on.
Yeah, but listen, traumatized can start as early. You said the child is 5 years old, right? Oh, she was.
I babysat her. I took care of her, took her to school, bring her home. I'm the caregiver. So I know she never experienced sexual or any physical abuse, at least.
Not even verbal?
Not even verbal. We babied her too much, as a matter of fact. And she was never out of my sight or her parents' sight. And there was no physical, sexual, or any type of abuse. It's just the first day of kindergarten, the bell went off, and she went crazy. They even went back to the preschool to find out, was there any issues in preschool? And they said, no, this is a different child than we've ever seen. And then all of a sudden, from that point, she went in the library, and she just went crazy that day, kindergarten. And we couldn't understand it. And since then, she's troubled with serious anxiety.
Well, that's you partially give yourself the answer. Because as we told you, sometimes a trauma, okay? So you may think ringing up the bell is not a trauma. But to the mind of the child, and then something startled her, and then she associated that with anything. This could be the trauma that started the problem. And
so then how do you remedy that?
Well, psychotherapy. Another thing also, sometimes young kids, if their parents were using substances, okay, this can affect the chemical composition of their brain and then cause them to have problems later in life. Okay, so all these things you have to take that into consideration to see exactly what really the problem. So maybe the trauma that started the issue is the bell. And then from that time, and then the only thing, did you tell the psychologist about this, the bell?
The school psychologist, outside psychologist, and the parents didn't do drugs.
Yeah.
Okay, so I just wondered a bell could make such a difference.
Yes, it's a trauma. For
me tell
example, for you a bell is not doing anything.
Let me
but
tell you something.
A child brain is different.
Yes, not just a child brain, because I can relate, not me, a friend of mine can relate to that. After 9/11, okay, a friend of mine, she was about 21, 22 years old. Okay, after 9/11, she was in the building, she didn't die, but every time somebody would come to her house and ring the bell, she would go under the bed and hide. Okay, she would go under the bed. She's from my church. She would go under the bed and hide. So they would have to get help for her because the bell triggers. When she heard, I don't know, something that she heard during 9/11, that she almost died. I don't know what it was, but whenever you would ring her home bell, she would go under the bed and hide. And her mom couldn't get an answer, went to a doctor. They just couldn't, therapies were done, everything was done. But I haven't seen her for the past 3 years. I don't know if she's still the same or if she's ill. But all that can be a trigger
It's
with
like-
the bell.
it's
So
like-
it's just an example.
It's like, for example, some
Okay.
people are afraid of snake,
Yeah.
and then the way they treat them,
Oh, okay. I
the
am
way they treat them,
terrified.
to slowly expose them to the snake until they say it's nothing. And then maybe if the bell is the thing, maybe they have to keep ringing bell on her until they find a solution.
Also, the rules in the house. If the rule is too strict or if the rule are too relaxed. So sometimes we as parents, we don't check on that. And then you cannot be too tough with the kids. You cannot be too relaxed with them too. You have to be in between. And whenever you have to be tough, you tough. Whenever to be relaxed, relax. But be in between, okay? That is a cause of depression, anxiety in the kids. So the childhood of the kids, the childhood age is very, very, very important. When you have kids, be careful, watch them well, and to make sure that you're in control.
Remember, you can ask anything.
Yeah, it doesn't have to
It doesn't have to be on psychiatry.
Yeah.
Can be anything.
You had your hand up. That gentleman.
Yes.
Oh, okay. Okay.
No, I was asking if split personality would be akin to being bipolar.
Yeah, okay. Well, it can be related with bipolar because sometimes the person can say, but I love these people, I don't love these people. So this, and for when they have diagnosis of bipolar, they can have personality disorders also in there. But we don't acutely treat personality disorder unless they talk to them, the psychologists, the therapists in the clinic, okay? But because they are not harmful, they can deal with it, function well, okay? For schizophrenia, they have like two types of personality disorders. They have a schizoid, a schizotypal. So the schizotypal, you see, type, a schizophrenia type. So because these patients, they are so weak, so they are old, so people don't want to deal with them, but they want to have friends. They want to have friends, but you don't want to deal with a schizophrenic patient. The patient will turn you off. But the other personality is schizoid. This one, they don't want friends. They don't want friends. So they have personality disorders too, but we treat acutely the main one, the schizophrenia, bipolar. The other ones, personality disorders, is just therapy, talking.
Yes. What can be done for neuropathy due to side effects of chemotherapy?
All right. Usually, once you start the chemo, the neuropathy will go away. However, while you're on chemo, there are medication they can give you to alleviate the neuropathy. Sometimes they can give you narcotic to calm the pain, and then other thing they can give is what they call gabapentin, okay, or Lyrica, pregabalin. This can help with this. But if it is caused by the chemotherapy, so when they stop, it will go away.
Doesn't go away.
Well, if it doesn't go away, when was the last time you get the chemo? The person get the chemo? Okay, 2 years ago. So it may not be only because of the chemo, because neuropathy can be caused also by what they call a herniated disc. If you
Herniated disc?
yes, if you have back pain and then your disc, there is some in between your spine, you have something they call a disc.
Right.
And then if you come out of this place and compress
Right.
the nerve,
Right.
you may have neuropathy.
Right.
So it could be that you had that, but the symptoms start with the chemotherapy, but it's not only the chemo that caused that. So the neuropathy can be from that, and also people with diabetes can have neuropathy also.
I don't have diabetes.
Yeah. So and then people who have diabetes, the diabetes can damage their nerve endings, and then causing this. Okay. So you may start feeling the symptom with the chemo, but in reality, it's not the chemo alone. You may have herniated disc that causing this also, compressing the nerves and doing this.
Right. I've been to the orthopedic doctor, and he did not address it. The herniated disc, my L2, L3, whatever, it's not where it's supposed, in the condition it's supposed to be in. And I do have severe back pain.
Okay, so this could be a reason. People have what, the sciatica, because the spine, in each space, there's a nerve that come out to go to innervate your skin, your legs, every part of your body. The nerve goes there.
Yeah.
So if something compressing it, you will have neuropathy. So if you have arthritis in your back also, sometimes
Right.
arthritis can pinch that nerve.
I do, yeah.
So all these things can be the reason.
So
But
what
you
can
start
I do?
you start feeling the problem because of this. So what can you do? Medication, physical therapy, and then sometimes it's operation. If there is something compressing it, to relieve the compression. Sometimes we give them steroid, gabapentin, pregabalin, all these things can alleviate. But sometimes after all these things, if you got so many level of herniation, it may be hard to completely remove the problem.
Yep.
Because you have so many damage in your spine, okay? Compressing every single level of spine that can be causing the problem. The medication will alleviate, but it will not really completely remove it.
No. I asked him about physical therapy, and he said, I didn't need it.
Well, you may say you don't need it, but if you insist, they can send you to see if it can help.
So I go to another orthopedic doctor then.
Yeah, you can.
Can do that because
I am going to one right now, but I'm not seeing what I want to see.
well, change them with somebody else.
Okay. So it's better to stick with the chiropractor right now then?
Well, the chiropractor, usually the chiropractor, what they give some exercises to see if they can move the bones and things like that. But I'm not sure if it's really going to help.
Okay. So go to another orthopedic doctor then.
Huh?
See another orthopedic doctor.
Yes, the orthopedic doctor, and then sometimes your own PCP can send you to physical therapy. It doesn't have to be the orthopedic. The orthopedic is not your primary care.
Okay.
So the primary care is the one that decide.
Okay.
Okay?
Thank you.
Behind you, sir.
No, let them.
Hi. There's a thing called a treatment that is used now. It's called spinal decompression. Elder McInnes, you could ask doctor about spinal decompression, and that might be an option that you can use for it.
Well,
with the back.
the scanner was just another word of telling you go to operate, because I was trying to explaining to the sister, when the spine or the herniated disc compressing, because
Yeah.
between inside your spine you got the spinal cord, okay? If there is something compressing it, we can call what they call a stenosis, spinal stenosis.
Yeah.
So it's compressing the spinal cord, it can cause you problems. Some people can even get paralyzed with this. So what they do, spinal compression, whatever compressing it, they just remove the compression.
Yeah.
Okay? So that's all that it is. Spinal compression is a type of operation to just remove whatever is compressing your spine.
Yeah. Because that was an option for me.
Uh-huh.
I had a fall on the job. I'm a social worker, and I had a fall on the job, and they said that I had a herniated disc, and my spine had shifted, and it worked for me.
Yeah.
You know, they put you on traction, and they stretch you, and thank God.
Yeah.
You know
Some
that
people-
I did get some relief.
It's
from
it's a type of physical therapy also.
Yeah.
So some people it works, some people it doesn't work.
Yeah, I was just throwing it out. Maybe that would be an option for her, being that,
Yeah.
you know.
You're blessed because I've known people who have done that, and their last result was surgery. Okay, so
Okay, so if a person has a fatty tumor, can it lead to cancer?
What is that?
If a person has a fatty like tumor,
Okay, this is what they call a lipoma. Usually, lipoma is not a cancer. However, some people, you may have a lipoma, and under lipoma, there's another type of cancer. Okay? But a lipoma in itself, which is a fatty tumor, is not a cancer. Some people don't like it because sometimes it appears some place that look ugly, and then they want to remove it. Okay? But if you leave it, it's not a cancer. It's a ball of fat that go in certain part of your body. And then sometimes if you have a fatty tumor inside you, okay, that compressing another vital organ, then it can be a problem. Okay? But the fatty tumor in itself is not cancerous, it's not really a problem. But a lot of people don't like them because of aesthetic. Okay, you may have it in your back, a lump in your back, in your arm, your legs, and then you don't like that. They tell you to go in there and remove it. But in itself, it's not cancerous. No, lipoma is not cancer.
no, he's saying could it become?
No, it doesn't become. It's a ball of fat. Yeah. Well, you know, fat goes everywhere in your body. So some people has a tendency to have more fat tumors than others. Okay, so it's not really a big issue, but it's more likely aesthetic. If it goes somewhere that, well, especially in the women, if you have a ball of fat there, it doesn't look good. So they want it to be removed.
Yes. Not a big surgery. You may not. I don't know how your program is at 6, 7 o'clock. You want to keep this, or you want to have consultation afterward? Or will we have time to do that? Yeah. Okay. Just want to make sure. Diabetes. No, it's not a problem. We don't have a problem. We could be all night.
Yeah, okay, cool. So let's talk about diabetes.
Sister McGinnis?
Can it be reversed? Is it reversible scientifically?
Diabetes?
Uh-huh.
Okay, a lot of people, I heard that all the time in the church. Oh, I reverse diabetes. I reverse this, I reverse that. Okay, so people say that because they don't know what really diabetes is. Because there are different levels of diabetes. For example, people may have pre-diabetes. For example, when you go to the doctor, you're not eating properly, your body cannot manage the sugar, okay? And then your A1C goes to 7 or 6.5, which is diabetes. And then you come to see the doctor tell you, okay, you have diabetes. Then the doctor said, okay, since it is not that advanced, you can do diet alone. Change your way of eating, exercise, And then if you follow everything the doctor tell you, your A1C go back to normal. They would say, oh, I reverse diabetes. No, you don't really reverse it. Because if you go back to the same way you were eating, it will come back again.
Yes.
Okay? So people say, oh, I can cure diabetes. No, you don't cure it. You tell the person, you give the person good advice, they follow what the advice you give them, and then when you go to the doctor will say, oh, you don't have diabetes. Okay?
Yep.
But a lot of people, when they see that, they say they don't have diabetes, they go back to the same bad habit, and the sugar go up again, the A1C go back up again. Okay? So that's it. A lot of people think, oh, we can cure diabetes. Some people do remedies, natural remedies. They say it's a diabetes, it's a natural remedies. In reality, it's not. While they're doing the natural remedies, they do the diet also. Okay? Yeah. So if they do the diet and natural remedies and then everything is go back to normal, that doesn't mean it's reverse. Okay? You control it very well. And then if you never see a doctor, you didn't see a doctor before, and then you go and see a new doctor, they check your blood, say, oh, you don't have diabetes. They will tell you you don't have diabetes because the test doesn't show it. But if you go back to the way you were before, and then go back to the same doctor, they'll check the blood, they will see that you have diabetes. So that's what happened. Now, there are different types of diabetes. For example, there are people that have diabetes, they need insulin. There are those who don't need insulin. Especially people who are heavy people. Okay? They have more tendency to have diabetes than those who don't. That doesn't mean people with skinny don't have diabetes. They can have diabetes also. But when you're heavy set, you don't control your diet, you eat everything you want, then you develop diabetes. The problem with diabetes, your pancreas is the one that makes insulin. People who have type 2 diabetes, they make insulin. However, the body cannot use that insulin. The reason they cannot use the insulin, you develop what they call insulin resistance. Because the more fat tissue that you have, the more difficult it is for the insulin to act on the cell to put the sugar back into the cell. Because you need the sugar, the glucose, for energy. If you cannot take that sugar from your blood to use as an energy, that sugar has to go somewhere. And then usually the excess sugar deposit in your blood vessels, tiny blood vessels, in your nerves ending, and then these are the ones that poison damage the nerves. When you damage the nerves, you got neuropathy, diabetic neuropathy. And if you damage the blood vessel, if it's the blood vessel that goes in your eyes, it breaks it, you become your retina, you can bleed into it, and you become blind. And then there are some tiny blood vessels also in your kidneys, because your kidneys not to function properly. You cannot remove all the toxin that your body is producing, then you have problem. Okay? So in reality, you cannot really reverse diabetes, but you can control it in a manner. Somebody will say, oh, you don't have diabetes because you control it so well, even without medication.
So you believe in genetic disposition?
Genetic is very real, okay? Diabetes is genetic and environmental also. And also, a lot of people who have diabetes is not because of the gene, because the organ that we have, the pancreas, is very important for us. We got a bunch of cells. Your pancreas is called beta cells. These are the cells that produce insulin. If you have an infection that damages cells, then you will not produce enough insulin. Then you become diabetic. If you have a tumor that damages your pancreas, you become diabetic. If you take some drugs that damage the pancreas, you become diabetic. People who drink alcohol become alcoholic, they develop pancreatitis. Chronic pancreatitis can damage the pancreas, they can become diabetic. Okay? So it can be the environment, the way what you
eat and drink,
lifestyle, and genetics. If you are predisposed to it, you can.
So your parents can pass on diabetes to you?
They don't pass it, but you are predisposed to it because the gene, you got the gene. It's not that they're passing the disease, but the gene that make predisposed to diabetes, pass it to you, then
Well, no, but in a sense, is it not just diet and activity? Because
what is that?
Okay.
is diet has a lot to do with
take that.
diabetes? Because if you
Don't
grow
forget,
uh,
don't
if-
forget. Diet do not give you diabetes.
okay,
Diet expose
okay,
your diabetes.
okay,
It exposes it.
mm-hmm.
Okay? But it's not the diet that causes you to have diabetes.
Okay,
It's something wrong with your pancreas that
Okay.
is not producing enough insulin that have the diabetes. And then you may not know if you have a perfect diet.
hold it in the middle, the mic in the middle.
Yeah.
Uh-huh.
So if you have a perfect diet, even though you are predisposed, you're not producing enough insulin, you have a perfect diet, okay, then you may not see it. But if you don't have a perfect diet, then your diet will expose it. You said, oh, you have a problem. Okay? So it's not the diet itself that causes you to have the diabetes, but it exposes it to make you know that you have diabetes. You cannot manage the load of sugar or glucose. Okay? And then it's not only, there are people, for example, young people, because juvenile diabetes,
Right.
they can have diabetes that need insulin, called type 1. Some of them because they have an infection that damage the B cells of the pancreas, or something genetic that can cause that enough B cell or enough receptors that the insulin would act on. You don't have enough of that, then they expose it, that you see that you have diabetes. But it's not the diet itself. We tell people to do diet because we know if you don't have enough of that insulin, and you're using ton of sugar, and your body cannot use it, the excess sugar has to go somewhere.
Right.
Then it damages your system. All right?
But diabetes seems like such an evil disease, though.
What is that?
Diabetes seems like it's an evil disease.
It's the worst disease that somebody can have.
Yeah.
Diabetes.
Yeah. You
reason
will
is-
die before you beat it.
Yes, it affects you mentally also. Imagine that you go to a party, you see everybody's enjoying them, eating everything they want. Then you can't. So you feel bad.
Yeah.
Okay. So and not only that, all the secondary effect of the diabetes, blindness. Sometimes you are walking, you don't even feel the floor. Okay, so you can have a piece of nail embedded in your feet. You don't even know that. It become infected, and then by the time you know it's too late, they have to cut your legs.
Oh my God.
Okay, you have to go to dialysis because your kidney is damaged, and then your kidney is one of the organs that clean your blood. So if you cannot clean it, the toxin increase. Then you have to go to dialysis to clean your blood 3 times a week. Okay, and they give you a heart problem. People who have diabetes have a higher chance to have a stroke or to have a heart attack. Okay, all these things. Okay, so it's a worst disease somebody can have.
Yeah.
However, I always tell my patient, somebody who is diabetic needs to be someone who is very, very meticulous. Because if you're not meticulous, you get a lot of problems. You have to know what to do, how to take care of yourself, your diet, all these things. And it's not easy. Human being is not easy to follow rules.
Yeah.
Then that's why a lot of people with diabetes end up with all this problem.
Yeah. Especially when you see that ice cream and the cake. It's very
Exactly.
Okay. Go straight to your bloodstream, right? Soda. Yeah. Enjoy. Yeah, but do you believe that medical right medical statistic? Do you think it's correct because we are like 12% of the population, we colored folks, but in every category we have the most of the diseases. Do you think it's statistically correct?
A lot of diseases have to do with the socioeconomics. Okay.
You're the disease man, so tell us.
Yeah, socioeconomics. For example, everywhere in the world, black people are always at the bottom of the social economic ladder. Okay? And then let's say you're living somewhere there is no vegetable store, fruit and vegetable. The only thing you see is McDonald's or Burger King's. And then
Popeyes.
you have Popeyes, you have money. This is what you eat. Okay? And then we know all these things, they bring diseases. Yeah, and vegetables are very expensive. So if you don't have money to buy these things and you have to survive, you eat them. And then most of, for example, we live in the area, most ghettos, a lot of
Depressed areas.
pollutions, all these things. So it's not because we're black, because it's not because it's something genetic that causes us to have all the diseases, but because of the socio-economic. Okay, we live in a world that is so prejudiced against black people. Okay, they took everything for themselves and they leave nothing for us. Then we have to live, and then by living, we're killing ourselves. Okay, so that's the problem. That's why you see all statistics, you see black, but it's not because there's something in ourselves,
Right.
but it's because what the society do to us.
That's right.
I can add. Listen, I know you may not like what I'm about to say. Minorities, they don't like to exercise. Minorities, they don't. I live in a neighborhood where every morning I see the white people, Caucasian or white people are exercising, never see a black. When I used to be in Brooklyn, I used to go to Prospect Park, and Prospect Park in Brooklyn, she knows because she's from my church. I would see a lot of white people because I used to have the habit of going in the morning, Sunday morning, just to jog. And I would be the only one or least one there as a black person. We don't exercise. We don't do these things. So that also, not just the economic reason, but that also. Okay? And I wouldn't just say black, I would say minorities.
But
Okay?
even
So-
that has to do with
Yes,
socioeconomic.
Well,
Because the reason
I think
the reason is for you to have the leisure of going to the exercise. Not only do you have nutrition, you need to have vacation.
yeah,
Most blacks, they have to work two jobs.
yeah.
They don't sleep at night.
Okay?
That's another
Where are they going to have the time to go and do exercise? Okay? So the white people, they did only one job. Sometimes they don't even go to work. They get their parents who leave them millions. They don't need to go and work. They'll go exercise.
Yeah.
So even that has to do with socioeconomics.
I'm actually encouraged the fact that. Go ahead.
for the pastor too.
Go ahead. Sister Lisa, she's
I just want to say too. I just want to comment on what you're saying about minorities and not exercising, and socioeconomics affecting Black people and causing us to have a lot more health problems. Also, too, I just want to add to what you're saying is that if you go into the white communities, they have gyms where you could just walk around the corner. You don't see that in Black communities. You have to take a bus or a train if you're in the city, and also out here they have walking trails. And out here, if you go into the city, like to get to Prospect Park, if you didn't live nearby, you had to take a bus or a train or walk 10 blocks to get to it. And it's not always in the safest neighborhood where you can walk. So we're very disadvantaged where it affects our health. So, and also too, a question about the diabetes. I have diabetes, it runs in my family. So lately my sugar's been going up and up and up. Can my mouth eat fruit?
Okay. People think because it's fruits, it's okay. No, it's not okay. Okay? Because sugar is sugar no matter where it comes from. Okay? People think, oh, it's from fruits, it's a good sugar. No, it's not true. Okay? So there are certain fruit you try to, for example, if you eat oranges, it's a poison for you. If you eat watermelon, it's a poison for you. Okay? Yes. Because watermelon have a lot of sugar. So try to, I'm not saying you not to eat. If your sugar is okay, let's say if your A1C is 6.5, 5.8, you great. So from time to time, you can eat it. Exactly. If you like that, you can give yourself a leisure of doing it, but do not abuse it.
Yeah,
Because when you abuse it, then you're going to start having problems.
Yeah, Yes, but there are some
What?
fruits. There are some fruits I think that are not going to are friendly to your glycemic index, right? It's they're like oranges is going to spike you. I think grapefruit is in a good range, and cherries, and berries. Berries are excellent for that. But
Listen,
if it's in the healthy
not-
range,
Do not abuse. If
Right.
your A1C is like hers, from time to time. But do not think because it's fruits, does it cause problem. Fruit can cause problem because they have what they call a fructose, okay?
good sugar.
Fructose, before your body can use fructose, it's converted into glucose, which is sugar. Then if you have too much glucose, then it causes problem.
So the thing is to eat less and move more.
No, please let them give you the microphone. Don't just stuck like that because we need to do it.
Give him a mic.
The boy that wants to.
Timothy's disappeared.
All right. No, I'll bring you the mic. Maybe your mouth is. We don't want your mouth to have any diabetes.
I just wanted to know, what are some of the good fruits that you can actually eat when you are predisposed to diabetes? Like, is pineapple one of those good fruits you can eat?
All the fruits are good. However, you have to make sure you know what you're doing. As I said, her sugar and A1C is 5.8. She is great. She can eat them, but do not abuse them. Okay? All the fruits have sugar in there. If you abuse them and your sugar is no good, then you have problem.
Yeah, portion also has a lot to do with it.
Portion size.
Portion, because for
People-
you can have a portion twice or 3 times a week, but it doesn't have to be on a daily basis.
People who are eating pasta also, pasta is a lot of sugar.
Even rice, carbohydrates.
Okay.
Okay, so you have a lot of things that, would affect.
And especially a lot of people like to eat white rice.
Yes.
A lot of black people like a lot of white food.
If your ANC is 7 and above, and then you have a problem.
All right. But
I said all the fruits.
all fruits. There are some
So
fruits
make
that
sure
are-
you know what you're doing. A lot of people, if you have diabetes, you check your sugar. Let's see if your sugar is 200. I don't expect you to go and eat some mangoes. It's going to be 300-400 after that. Let's say if it is 100, okay, you can eat this little mango and then 2 hours later check if your sugar is high. If it is insulin you have, you can give yourself a little dose, okay? So some doctors, they give patient what they call a sliding scale. They tell them how much insulin they should put when their sugar is certain level. If your doctor gives you a sliding scale and you're using insulin, tell you, let's say if your sugar is between 100 and 150, you don't need to put anything, or you put 2 units. If it's 200 and 300, you put 5. He give you a sliding scale so that you can get an idea what you should do. But some people they just don't do that. They just eat.
Yeah, you
And
also
then-
need to check your sugar.
They don't check your sugar and then. it goes
Doctor,
around.
tell us about metformin. Now we have a Descom. I see they advertising it. You can put it on your hand. You can check your
Yes.
glucose level. It can tell you where it's at, and it can tell you where it's going to be, and then it can also tell you when you probably need some insulin. But tell us about metformin. Is it a good thing to take, and what is it doing to the patient's body?
Okay. Most people, when they start with diabetes the first time, especially if you're a person who is obese, we start with metformin. Because the way metformin works, it makes the cells to become sensitive to insulin. Okay? People who have type 2 diabetes, it's not that they don't have insulin. They do have insulin, or they're not producing enough. However, because of the fat cells, they become resistant. Since they become resistant, the insulin cannot make them grab the sugar to utilize it. So what metformin does, it makes the fat cell become sensitive to the insulin, okay? And also it can stimulate your pancreas to produce more insulin, okay? So what it does, it stimulates your pancreas to produce more insulin, and also it makes your cell to become sensitive, and then you can grab the insulin from your blood, you metabolize it, so it lowers insulin. Now, every medication, anything in life has side effects. There's nothing in life that don't have the side. Even water that you drink can kill you. Okay? Nothing in life. So I heard people say, oh, you give me this medication, you give me these side effects. Because they don't understand. Because there is nothing in life. Anything you do in life can kill you. Let me finish.
Well, let him finish.
For example, even sitting here, I'm taking a risk.
Yes.
You never know, and then the ceiling can fall on me and kill me. It's a risk.
Not this church. This church is sanctified.
Yeah. So the reason I'm saying that there is nothing in life that do not have side effects. So what we should do, we should learn what the side effect is. If it happens, your doctor will stop it. But do not say, oh, you give me this, he gave me this, you give me this medication, it caused me to have this. And then a lot of people have me a lot of one because of that. They don't take their medication because they say, oh, it's going to give me side effects. And I have patients, and I always tell them, they come to see me, they wait 2 hours waiting for me because I have patients waiting, 2 hours waiting. And then when they come to see me, and I tell them, okay, tell me a certain such medication I'm going to give you. I give them the prescription, they take the prescription, come out. Immediately, they go to the waiting area. Other patient says, oh, the doctor give you something? Oh, don't take it. It's going to kill you. Yeah. And then they believe the patient, then me. And I tell them, listen, why did you come to see me? You spent 2 hours. You could have used your 2 hours doing something else.
Yeah, it could be jogging.
You spent 2 hours waiting for me, and you come, and I tell you this is what you do, and then you get out, a person who didn't have only 1 second on medical school. You believe them than me.
That's right.
And I say, what's going on with us?
Yes, sir.
This is human beings, this is how we are. So we have to know what your side effects is, okay? And then if the side effects happen, the doctor will stop the medication. But do not say, oh, I'm going to say no side effect. See, if you do that, your diabetes will continue to worsen. Then you will have eye problem, you will have nerves problem, heart attack, stroke, all the complications. Okay? So that's why you're a patient, you go to the doctor, you ask questions.
Yeah.
Okay? Ask questions, the doctor will explain to you, and then make sure you understand what you say. And a lot of things also. Sometimes the patient, you tell them something, they interpret it something else. That's why I always tell the patient, do you understand what I'm telling you? Repeat what I tell you. Because you tell them one thing, they understand it a different way. And then they go outside and say, oh, the doctor tell me I should do this. And then when I say, I never told you that. But this is the way they understand it. Because people understand things differently.
Yeah.
If you don't make sure they understand exactly what you tell them, it's a problem. So, metformin is not a bad medication, but there are side effects. So one of the reasons we give metformin, I explained to you that it's caused it stimulate secretion of insulin and then make it sensitive, and also metformin make you lose weight. A lot of people who are heavy, when you give metformin, the metformin causes them to become full, and then they don't want to eat. With that, they decrease your sugar, and then you lose weight also with metformin.
What about Ozempic?
Ozempic also is another medication. At the beginning, they use it for insulin, for diabetes. But they found out the side effects of Ozempic is weight loss. So because of that, they use it for weight loss now. Okay? So if you need to lose weight, one shot of Ozempic every week, this can help you lose the weight. Okay? So there's a lot of medication. There are different ways they work. Okay? So you have to ask your doctor, ask questions, know the side effects, and then see if it happens, and then you tell the doctor, they stop it. But don't say, I'm not going to take it, and then meanwhile, this is killing you.
All right, a hand here from Mrs. Grant, gladly. Go ahead.
Thank you. Question 1, how can we repair the pancreas? And then question 2, I noticed that in driving, then there's a vein that show up in the legs. So what can you say about that?
Okay. We cannot repair the pancreas when you damage when the islets, B cells, when they damage. The only thing you get, there are studies, for example, there are studies in Mexico. They use embryo from rats. They take the B cell from the pancreas of rats and they put it in human to see if it can produce more insulin. So studying are being done to see if they can do that. But once your B cell is damaged, it's damaged. Okay, so you cannot really repair it because it's damaged. Either an infection damage it, decrease the amount, then that's a problem. Okay, so you cannot really repair it. But studies are being done to see if we can make some implant of B cell to the pancreas. So the other question was?
And she has a vein in her leg for driving. Okay, so would you suggest that she start walking?
We have we have vein in our legs, and the veins, they are what they call valves. Okay, so the valves, they open one way, and they prevent. For example, the vein take blood from your extremities or from your cells, goes back up to your heart. Okay, now because of how do you call this in forgot the name, because of gravity, when the blood come up, it has to come down.
Right.
But the veins have these valves. Every time the blood goes up, the valve close, push it up again, close to prevent it from going back. But there are certain people, you get leak on those valves. And you spend a lot of time standing, sitting. If you are constipated,
constipation.
When you're pushing, you have the tendency to push that blood back down.
Yeah.
And then when the blood accumulates in your legs, it come out in the vein and goes into the cells around the vein. And it's getting inflamed. Sometimes people get what they call a pedal edema. And also the vein get dilated because too much blood remain.
Right.
Okay. So this is what they call varicose vein.
Right.
Okay. What causes varicose vein? Usually pregnant women has a tendency to have varicose vein. Not only varicose vein, they get hemorrhoid also. It's the same thing. The varicose vein and the hemorrhoid are the same principle.
Right.
People who drive taxis, they have a tendency to have varicose vein or hemorrhoid. People spend a lot of time standing.
Right.
Okay, they have a tendency to do that.
Yeah.
So one of the way they fix that, when you have varicose vein that's so big, it's painful. They can fix the valves. Okay, and so they can operate them to fix it.
Right.
Okay, but that depends on how bad it is.
Yeah.
Usually they start like what they call spider veins.
Yeah.
Very tiny veins. It can be painful. Sometimes they breaks, and then you see black and blues in your legs because the veins just breaks and the blood come out and then on their skin. Okay. Sometimes they can use laser to close these veins. Okay. And then the last thing is fixing the valve, and also sometimes they give you there's a socks. Okay, they call it compression socks.
Yes, right.
So you put it, that press your vein to push the blood up. Okay, so that's what the varicose vein is. Okay, there's operation, there are laser operation, varicose socks, and then don't spend too much time standing or sitting. And if you are constipated, you can develop hemorrhoid. Try not to get constipated.
Yes. And would rough edge help them with constipation?
Yes.
And walking and exercise and drinking a lot of water?
Yes.
Would that assist them?
Yes.
All right.
And then change the bad habits. Some people, they have they want to they have the urge to the bathroom, but they're so busy
watching TV.
They don't go. They wait 2 or 3 hours after that. All the water that was in the stool they get reabsorbed
Wow.
in the colon,
Mm-hmm.
then become hard.
Mm-hmm.
Okay, so bad habit also. You want to go to the bathroom? Go.
Go. All right. I see a hand over there. Sister Kay, welcome to the open forum. Huh?
No, there are two different valves. I was talking about valve in the legs, but there's valve in the heart also. It's two different things. Okay?
So
the valve in the leg is different than the valve in the heart. Okay,
so they are saying that she's saying that somebody has a valve situation in their heart and experiencing constipation.
okay, so this person, one thing also, sometimes after you have a heart operation, especially a valve, the doctor has a tendency to give you something to make you go to the bathroom. The reason is because when you have a heart problem, when you push, there's something called Valsalva maneuver that cause more blood to go to your heart and cause your heart to pump more blood. So if you just have a valve replacement, you can damage that valve. Okay, so there's a tendency when you go to the bath to get an operation, while you're in the hospital, the doctor wants to make sure that your stool is soft. They don't want you to just push to damage the operation that you just got.
All right. Go ahead. Yes, no problem.
Real quick about what could possibly be the cause of blockage in the pancreatic duct. And if you're told that you need the pancreatic duct need to be cut and attached to the small intestine, what's the mortality rate on that?
Okay. Now, there are people who have what they call cholangitis. So the duct that goes to your pancreas and then connected to your bile duct. Okay. Sometimes they develop what they call stenosis. Okay, something that may irritate them if you have a type of infection. They become fibrotic, and then the duct, the tube, become plugged. And then sometimes people have cancer of the bile duct. So if you have cancer of the bile duct, it blocks the bile ducts. So all the biles accumulate. This person become jaundice. The eyes become yellow. They get scratching because the bile duct, there is a bile acid. It irritates the skin. You have this. So what they do, if it is cancer, sometimes they can do, it's not an angiogram. They can do, they can put a little tube. If it's stenosis, you can open it. But sometimes it doesn't work. Sometimes if it's a cancer, what they do, they take the piece of the portion that is black, they remove it, and they connect it to the intestine. The reason is the bile is one of the things that we use to digest fat. Without bile, you cannot digest fat. If the bile doesn't digest fat, sometimes you can go to the bathroom, you see your stool is white because you're just pulling the fat, okay? Because you don't have the bile to digest it. So what they do, they do the type of operation called JNY type of operation, so that they bypass the blockage. So what are the problem? It's actually a bypass. As I say, you can have a lot of diarrhea because you're pulling fat, you're not digesting your fat, okay? Infections, okay? So all these things are risk of having this type of operation, okay? But your bile is very important for you to digest fat. And then when you have this blockage, you cannot go to the gallbladder, okay? Because the bile, before you can use it, your liver producing the bile with the breakage of some of the red blood cells, they take hemoglobin, the heme, they form the bile, and then it goes down to the bile duct, and it remains in your bile duct, in the gallbladder so that when you eat something fatty and your gallbladder start contracting, pushing the bile duct into your intestine so that it can manage, you can digest the fat. So that's what happened, okay? So you can have diarrhea, okay? You can get infections, all these things when you do this type of operation.
All right, thank you so much. Now, we want to give some time for consultation. And so we are going to have this room here, I don't know, right? All 4 doctors? Huh?
He's a social worker.
Okay, social worker, all right.
If there's anybody with social situation.
Social situation can see him. We have social work, all right? So
this is what we can do.
So, yes.
If there are people who still want to ask questions, one of us can stay and the rest can go and do one-on-one.
All right. So anybody want to see the doctors one-on-one? Anybody wants to see any? Yeah, but answer my question. For anybody wants to see the doctors one-on-one? You want to have a consultation with them? You want to have a consult? All right. So okay. So
but you would have to go to the nurses first.
Okay.
Anybody would have to see.
Anybody want to see the doctors? And he said, go to the nurses first.
People waiting for us outside.
All right. Oh, yeah, people waiting for you? Yeah. Okay. So then, all right. So what you want to do? You want to start consulting now?
There are people who still want to ask questions.
Yeah.
One of us can, well, I'll let him here.
You leave him here to answer questions. All right. All right. So, all right. So, so Dr. So you go to you go to my office.
Yeah.
And then you go to the secretary's office, and then one can also, a social worker can stay in this room or in the mother's room. All right.
Where's your office?
My office. If you go out and go straight over there, they will tell you. Sister Wilson will tell you where my office is, and the secretaries. Or the Cheryl to show him my office, or follow Elder Mendez. Elder Mendez will lead you to my office. All right. Okay. All right. Sister Johnson, your question. Go ahead. Huh?
Swelling in your feet? Okay, there are many things that can cause that. One thing that I explained when they are asking about the vein, sometimes when you spend too much time standing, okay, the blood has a tendency to accumulate in the lower part of your body, come out of the veins and go into the cells, okay, that they call it interstitium, and then this make your legs swell. This is one reason. Other thing, people who have heart problem. People who have heart problem, okay, this is what they call congestive heart failure. The heart is the one that push your blood to go throughout your body, okay? Now, if your heart is weak, it cannot push that blood throughout your body, then this blood has a tendency to accumulate in the right ventricle and then goes back to your, what they call a vena cava, to the periphery, and then inflame your lower extremity also. Other thing that can cause that, people who have liver problem. If you have liver problem, you have one protein in your body they call albumin. The albumin, what it does, it helps to keep the blood inside your vessels, your arteries and your vein. If you don't have enough, if your liver does not produce enough albumin, so if you don't have enough albumin in your liver, in your blood vessel, so the blood, the water in your blood has a tendency to come out of the blood vessel and goes into your legs. Another thing it can cause that is kidney problem. If you have kidney problem, the kidney is the one that clean your body. If you have too much water in your body that make you get it out through your pee, all these things, if the kidney cannot remove all that water, it will accumulate and it will go into your legs also. Other thing is some certain medication. There are medication you're taking, for example, people who have high blood pressure, if taking what they call a medication called amlodipine, okay, patient who take Procardia, this medication has a tendency to make your legs inflame. make your legs big because of that also. People who have what they call ACE inhibitor, sometimes lisinopril, can do that also. So there are many things that can cause that. It's not only one thing. So we have to know what it is, and then if we know what it is, the doctor will see how we can solve the problem. Okay?
Okay. Any other question for the doctor? Right.
Going back to the conversation about diabetes, you mentioned metformin. Is berberine a good substitute to use for metformin?
Which one?
Berberine. It's like a herbal remedy. Is that good?
What's the name of it?
Berberine.
Verbalin?
B-E-R,
Berbalin?
B-E-R-I-N-E. Berberine.
Is that a medication that the doctor give you?
No,
or?
it's a herbal supplement.
Well, I don't know about it. If somebody use it and they check it, if it works, fine. But I'm not sure about that.
Yeah, it's plant-based. And also cinnamon.
Well, cinnamon, I don't know any study that shows cinnamon decrease your sugar. Well, if it works for you, that's fine.
And my A1C at that point was 5.8.
Mm-hmm.
I told my internist, I said, give me 3 months. If within that 3 months, if it has not changed, then I will allow you to put me on medication.
Okay. Did you do anything else beside the?
No, I just put cinnamon in my tea every morning.
Yeah, but did you do anything? Did you change your diet? You do this?
Well, my diet was because I was always a person who believed in health, so I was eating healthy. So I didn't have to really change anything else.
That's what I was trying to explain earlier. Yeah. Okay? You do one thing, and then you say, this is what works. But without thinking that you do other things that can work also. Because if you do your diet, you don't eat, when the doctor tells you have pre-diabetic, and then they tell you, okay, don't eat this, then do that, do some exercise, and you follow the instruction, right? And you do the cinnamon also, you would say, oh, that's the cinnamon. But you don't remember that you make some other change also. So that's why I tell you, is it the cinnamon? I don't know.
I didn't make any other change.
Okay, so.
Because as I said,
it's the cinnamon.
The
only thing I can tell you, we will not go ahead and prescribe people cinnamon until we test it to see exactly really this is what it is.
Well, it worked for me.
Okay, so it's worked for you.
Yeah, so you change one factor, and so you can't, as they said, scientifically you can't say it worked for you because you change one factor. There may be other variables that you probably have changed.
Exactly. That's why in science, when you're doing studies,
right,
you have to make sure you control all the variables.
That's right.
Sometimes when you test something, and then there's something called a bias, you don't see there's a bias, and you think, oh, it works, but it's not true. But there's something else you are doing that causing it to work also.
That's definitely. Yeah. She might stop worrying. All right, but what he's saying, he's a medical physician. He's not a herbalist, so he has to look at the scientific studies, come up with scientific data he can't recommend something that is not scientifically tested and proven. All these are herbal things that we know that curcumin and all these factors might play a role in it, but there's no scientific data to support that. So he can prescribe cinnamon or curry, right? We know these are spices that maybe have an effect on sugar metabolism, but he cannot tell you that because he has no study, right? We understand what's going on here? All right. Okay, any other question for the doctor? All right.
What causes the stomach to get bigger after surgery?
Okay. Now you have to see what kind of surgery. Not all surgery make your stomach big. Okay? So now people call this stomach, but this is not the stomach. This is your abdomen.
That's right.
The stomach is an organ that when you eat food goes there and things like that. Now, when people have fibroid, okay, your abdomen get big. The reason is because within your abdomen, the lower abdomen, you have the womb. The womb is a muscle, and the fibroid It's like a tumor, a benign tumor, that the muscle get big. So when it get big, your uterus get big, so it increase the girth of your abdomen. You see, your abdomen is big. The same thing, for example, when a woman get pregnant, the baby goes into there, your abdomen,
Uterus.
your uterus get big, and then your abdomen get big also. So if you have a fibroid, okay, it play the same role as if it was a baby. So it make your uterus get big, and then it push up your abdomen, it get big. Now, if after an operation, if they remove the fibroid completely, your abdomen may maybe get lower, but it may remain the same also, because it's not only your abdomen has many things. We have something they call the omentum. It's like a mantle of fat that cover your intestine. If you have a lot of fat in there, this make your abdomen big also. So was it the operation? I'm not quite sure this was the operation, okay? But fibroid can make your abdomen big depending on how many fibroid, how big it is, and where it is in your uterus.
So even after so you're saying even after the fibroids have been removed, you can still have a distended abdomen?
Yes, you can still have a distended abdomen.
Okay. Because
it may go down after a while, but if the operation is recent, you may still have a distended abdomen.
Okay. All right. Sister Carr.
What happened? Yeah, what's the question? Well, if you have a stone, okay, the reason of a gallbladder is to accumulate bile. Keep it there, so when you eat, you can push it out. Now, if you have a gallbladder that is full with stone, so the function is not there anymore, okay? And the stone, every time you eat something fatty, your gallbladder starts squeezing because you think it has bile, but it's squeezing on the stone. Will give you pain. And then sometimes bacteria can go into that gallbladder filled with stone. It give you what they call cholangitis. It give you cholecystitis. And then this infection can kill you. So if you have a lot of stone in there, and then you have a lot of pain, the best thing is remove it. However, there are some people, they have stone, but it's not completely filled the gallbladder. You don't have that much pain. So the doctor can tell you, okay, you don't have to remove it. Sometimes they give you a medication that can, with time, can dissolve it. They call estradiol. It can take maybe a year to dissolve that stone. But if it's your gallbladder is completely full, and then sometimes the gallbladder can be coated with with the stone, it become like a glass. Okay? So this gallbladder doesn't work with you anymore. So the best thing is to remove it instead of getting an infection. And then sometimes if you get an infection, it's an emergency operation. And then whenever you're going to do an emergency operation, the risk of dying is higher. So it's better to. Well, you will have problem with digesting fat, because as I told you, the gallbladder is the one that, the bile. You still produce bile, but you may have some indigestion with fat because not enough the bile to just digest the fat. Yeah.
So can you pass the stones naturally? Usually they say you know symptoms of, in Jamaica they used to say when you fear fat and 40, you have.
Now, if it is very small fat, a small stone, and then while the gallbladder is squeezing, it can pass to the bile duct,
right?
And you can pass it if it's small. But most of the time, this doesn't happen.
Right.
So it stays there, and then you keep having symptoms.
And it's easy, you know. It's laparoscopically. They go through your navel and remove it.
Yes.
You know, back in the days they would cut you from up here to down here to remove. But now it's easy.
Before they used to just make a big cut here.
Yeah.
But now,
yeah,
they put a little hole here, and the umbilicus with a camera.
Remove it. Ambulatory. You go into walk in and walk out in a couple hours. But Sister Francis, you're not satisfied. You're still on the cinnamon thing. Okay, let me bring you the mic. No, yeah, we know that, but speaking of
Yes, I just want to find out about hernia. Is it important that you have it removed?
Okay, there are different type of hernia. Okay, there's an hernia they call hiatal hernia. Hernia, it's your stomach. For example, your abdomen
Come right in, Brother Johnson.
is divided into two parts. There's a muscle they call the diaphragm that separate the upper part and from the lower part. In the lower part, this is where your stomach is, and there's a hole through the diaphragm that connect your mouth, the esophagus, with your stomach. So when you eat food, okay, the food has to go through the esophagus, down through that hole that I told you in the diaphragm into your stomach. And in your stomach, there is a little muscle we call the sphincter. So whenever you eat, the sphincter closes so that whenever your stomach starts squishing the food, it doesn't go back up. Because if it goes back up, all the acid will burn your stomach, will burn your esophagus. However, this hole that I tell you, that in the esophagus, sometimes in the diaphragm, sometimes it's too big. It causes your part of your abdomen, of your stomach, to go up into your chest. So if part of your abdomen, of your stomach is into your chest, so the sphincter doesn't work that much. So this is what they call an hiatal hernia. If this is a big hiatal hernia, so you have to operate to close that hole. But if it is not big, they don't do anything. They just give you medication. They tell you not to eat too much, too late at night. Okay, don't put things that is too tight, because when you do that, the food has a tendency to go up and burn your esophagus. So this is what they call hiatal hernia. Now there are other type of hernia. For example, you can have what they call an inguinal hernia. What is an hernia is? Hernia is one organ want to pass through a hole. Okay, so sometimes in your inguinal area, you have muscle and then you have a membrane. Sometimes this membrane become weak. Okay, when it's become weak, and then when pressure inside your abdomen is big, this pressure has a tendency to take your intestine to push it through that hole. Make it pass through that hole, and then you see a big bulge in your inguinal area. Now, what happened when your intestine go out through that hole? You can push it back in, but sometimes what can happen, the hole, the intestine go in, and then the hole tighten, and then you cannot push back that intestine. So when that happens, it's what they call it strangled. Your intestine becomes strangled, so it cannot come out. So if it's strangled, you cut all the circulation to your intestine. So your intestine can die. Okay, you can have an infarct of your intestine. So if you have an infarct of intestine, this is an emergency. You have to go take you to an emergency, operate immediately. If not, you can die. So that's why some people, when they get hernia, and then that is bothering them all the time, having pain, and then to prevent strangulation, so it's better to operate to close that hole. Usually they do it, they put a mesh, okay, to close it, to prevent your intestine to go out again. Okay? There are other type of hernia. Sometimes you have what they call a ventral hernia. We got muscle in your abdomen. Sometimes the muscle spread apart, and then your intestine want to go through your abdomen also. And then people have pain, and then sometimes they want to operate. So is it necessary to operate? That depends. If you're having pain, and then you don't want to get an emergency, yes, it's necessary. But if it's not painful, it's small, sometimes they can give you to put there's some type of
mesh, not a mesh,
of type of underwear that compress this to prevent it from coming out. Okay, so there are different types of hernia. That depends on where you have the hernia. Okay, and then each depends on the severity. Is it necessary or not? That depends on the severity.
Thank you, doctor. Now, if there's anybody who needs to see the social worker, he's in this room right here if you need to have a social worker problem. And the other medical doctors are over, one in my office and one in Sister Wilson's office. Sister Kay. They're here to grow? Oh.
Well, I'm not aware of any of thing that when you manipulate your scalp and you feel pain in your legs. I'm not aware of this. However, I know according to the Chinese, there are some point connection in your skin. That's why they practice what they call
acupuncture.
Acupuncture. So there are some point that connect some part of your body. Okay. So maybe if what the Chinese say is true, okay, so maybe that's what happened. But I'm not aware of any diseases that cause this problem.
What about the sympathetic or parasympathetic nervous system that might be sending sensation from here?
Well, sympathetic and parasympathetic is two different things. Okay, so we have sympathetic nervous system. For example, it's a nervous system that connect basically all the nerves through chemical stimulation. For example, you got adrenaline, okay, which is part of sympathetic nervous system. For example, when you're nervous, or you have to be, for example, if somebody, the sympathetic nervous system is what give you what we call in medicine, fight or flight.
Yes.
When you have a problem, and then you need to be on your toes, so the sympathetic nervous system just cause your eyes dilate, okay, and then start
Heart
sweating,
racing, yeah.
and then so that it make you ready to fight or run. But the parasympathetic is different. For example, is the one that, for example, your heart rate, both sympathetic and parasympathetic act on it. For example, what they call, you got something called acetylcholine, which is another substance that use that send signals to your heart.
Right.
Okay. So these are a system, a connection of nerves, okay, directed by substances, what we call hormones. Okay. So this is what happens. But is it when you touch your head that goes? I'm not sure.
Right. Because I know we all have a bag of nerves, so sometimes you touch one place and you feel it someplace else. Yeah, my wife always, when I'm massaging her, she says, you touch here and I feel it down here. So, yeah. All right. More questions for the doctor? We have physicians in the house. If you need a consult, we have a social worker, one in here. We have two medical doctors over on the other side, one in the pastor's study, one in the clerk's office. And you can have a private talk with them if you need that. Question? Yes, go ahead.
Let's say from your hair or maybe from your lips, seeing that it starts with maybe just a little, I don't know how to describe it, but gradually you start seeing that the skin start growing and it's getting hard.
Well, there are people who have what they call skin tags.
Yes.
Okay, skin tags. Some people are genetically predisposed to have that. Okay, usually if your family have skin tag, you probably will have skin tag also. And then the other thing is not skin tag, but it's like blackish thing that coming up. All these
like warts. And
some of them are warts. Warts usually it's a virus that causes that.
Okay.
But the other thing is not warts. It's something genetic. And then sometimes also you got it's like we have some seborrheic dermatitis.
Right.
Some fat. Okay. And then fat gland, you get this growth coming out.
Yeah.
As we go older, this thing come out more often. Okay. But this most of the time have to do with genetics. If your family has it, most likely you're going to have it also.
All right. What about acid reflux.
Okay, as I explained in a moment about the hernia, some people may have what the hiatal hernia. So the stomach, instead of staying in the bottom part of the diaphragm, part of it goes up because of the sphincter. There are food that can relax the sphincter. For example, people drink coffee. Coffee has a tendency to relax the sphincter. People, caffeine, smoking, fat, greasy food, or spicy food has a tendency to relax the sphincter. So when you eat a food that relaxes the sphincter, and then your abdomen starts squeezing that food, instead of the sphincter to close it to prevent it from going back, then part of the food goes back. And then since your stomach has a lot of acid, and you feel that burning sensation that goes back to your chest, as even to your throat, you feel that burning sensation. This is acid reflux. So how do you prevent that?
Yeah.
If you know there are some food that you eat that cause that,
triggers.
Stay away from coffee. Not really sugar. Coffee, spicy food, greasy food, soda. Okay, all these things have the tendency. It's tomato. Okay, all these things can relax your sphincter and cause your food to go back, and they give you acid reflux. So stay away from these things, and then if you stay away from things, sometimes they give you medication to just relax, to prevent that burning sensation that you have in your stomach that goes up to your throat. So diet, okay, avoid these things, and then if it's so bad, sometimes they give you medication to calm it down.
Okay. Brother Johnson.
Well, not necessarily. There are some medication they give you, you have to take it at bedtime. Okay? So there are certain medication, I mean, if you take it, you go to sleep immediately, right? Anything, even it's not even medication, food, water. Okay? If your sphincter is not closed tight enough, you can get regurgitation. And then if you don't have, if you put have some clothes or a belt that tighten, this can increase your pressure in the abdomen and push the thing up. Okay, so it's not really necessary. It's not that you cannot take medication at night, because certain medication they tell you to do it to take it at night before sleep. Okay, so but yes, you can have. If you take a medication, then you want to sit, especially if the medication is a capsule. The capsule has a tendency to stick in your esophagus before they go down completely. So it's better not to do it that way. And also, one medication the doctor always tell you, when you take it, do not sleep, do not sit. I mean, do not lay down. You can sit, you can walk half hour. It's what they call Fosamax.
What's that?
Fosamax. Fosamax is a medication that we give for people who have osteoporosis.
Okay.
Okay. Because when you take it, if it stick in your esophagus, you can burn it. So we tell you, make sure you take it with full glass of water. Do not go to bed or do not lay down. You can sit or walk at least half an hour so that the medication can go to your stomach.
Move down. Okay.
So the brother didn't even listen to the question that he asked. Is he talking?
Yeah. All right. Any more questions for the doctor? All right. Doc, seems like you have solved all the questions that the folks have. And
I wish I got the solution. I would be the richest man in the world. Well, all joking aside, if you do a good diet, exercise, sleep well, don't come to church, and then don't abuse your body, then you can do that.
Yeah.
Okay? Because a lot of people get old quicker because they abuse their body, using drugs, they're not sleeping. The only thing is work, never rest. Then this can have a toll in your aging process. Yeah.
But I don't know, I don't even understand the word premature aging, because your age is what you are.
Well, there are people.
Yeah, you know, but the appearance.
Yes.
Of
yes.
the-
Well,
yeah.
that's what I think you mean. The appearance of getting old quicker.
Yeah.
But there are some people also, because of genetics, they look older than their age, and the reverse is the same. There are people who are older and they look younger.
Yeah.
Because of genetics.
And you can use some dye too. People dye. Yeah. Go ahead, Sister Kay.
Okay. Well, there are people who have sinusitis. Okay. There are people who develop allergies. Okay. If you have allergies to the fume or of the perfume, it can give you headaches. Okay. And then it can be very discomfort. Okay. So because of allergy, your body does not tolerate well that scent, and then you get, for example, whenever you have an allergy, your body produces a lot of chemicals. Okay. There's something called histamine. Some people, when you have an allergy and you start sneezing, and you start having runny nose, it becomes histamine. Okay. And then there are things they call vasoactive substances, that this chemical cause your blood vessel to squeeze. Some of them it causes it to dilate. So all this has an effect on your system. It's a sneezing, headache, sometimes you can blurry vision, all this stuff. So it depends on allergic reactions. If your body doesn't tolerate something, then your body reacts to it. So, and then produce all these substances that supposedly should help you, but they give you symptoms. For example, fever, for example. Fever, people don't like to have fever, but fever is a good thing.
Yes.
So it's your body trying to protect you. And then when you get something that enter your body that should not be there, it stimulates the hypothalamus and then produce substances, and then your body, your temperature increase, so that to prevent the infection or whatever to spread. But you don't like that, you take some Tylenol to decrease it. But sometimes we give people medication to decrease the fever, because sometimes when your fever is too high, it can give you, people can have seizure. So sometimes we do that. But fever is not a bad thing. It's your body trying to protect you.
All right. And so, if you, yeah, go ahead, sister.
Well, she probably need to go and see an ENT to make sure she don't have any hearing problem. Oh. Okay, so yeah. Well, if they give you, you have to go and see the doctor to check your ear, and then if they see that you have, they will do some tests for you, and then if they see they have any hearing problem, they will give you hearing aid. This will help you hear better.
Yeah.
Okay, so a lot of people don't like people to tell them they cannot hear. Okay, and then most of the time it's not them that don't know they don't cannot hear. The people listening, why are you yelling all the time? Because they have to yell to hear themselves talking, and then it's a problem. So if you go into the test, they see you have a hearing problem, then they can view you in aid to help you. Yes. Well, then she need to check. You need to go in ENT and check.
Yeah, check it out.
And also sometimes people can have a lot of cerumen, a lot of rocks, okay, that block their hearing. So
they got to flush it out.
They have to flush it out, and then to help. Some people, the cerumen is so hard, it's like a piece of rock.
Mercy.
So nothing can come in because it's blocking. It's like putting a plug, and they have to remove that. So if you go see an ENT, they will check. If this is what she has, they can wash it, and then she will hear better. Yeah.
All right. All right, Brother Johnson, go ahead.
Okay, the pancreas is the organ that makes insulin. Okay? So without your pancreas, you don't produce insulin. So when your when your pancreas is damaged or there's a problem with the pancreas, you don't produce enough insulin. So when you don't produce enough insulin, this is what we call diabetes. Okay? So pancreas produces insulin. So we all have insulin in our body, except those who have diabetes that cannot produce it. Okay?
All right. So, all right. Hypertension or high blood pressure. What are the leading causes of hypertension?
Okay. People hear about hypertension. They think hypertension is the same for everybody. Okay? So when your pressure, normally, after study shows that most people, their pressure normally does not go up than 140/90. Okay? So when it goes to 140/90, so we classify it as hypertension. However, there are recent studies that we classify that because some people have pre-hypertension and some people have hypertension. Let's say if your blood pressure is between 120 to 135, we say 120 to 135 over 80 to 85, we call it pre-hypertension. Okay? Even though you don't have hypertension, but you are right there, so you have to start trying to make some change in your diet. Stay away from salty food, do some exercise and things like that to prevent your pressure to be high. Some people have essential hypertension. That means probably some genetic thing in their family that cause them to develop hypertension. Some people have hypertension because of stress. It's something that it's not permanent. Something can make you stress and then cause your hypertension, your pressure to go high, more than 140/90. And then if the tension, the thing that causes you stressful, from calm, your pressure come to normal. Okay. There are people who have what they call white coat hypertension. So white coat hypertension means there are people, whenever they go and see a doctor, the pressure goes high. Because they see the doctor, they see the white coat, they get nervous, their pressure is high. And then these people, when you see them, what we do, we tell them to buy a blood pressure machine, check it at home, and then we can do us. Again, we check, and then we can see that when they're home, their pressure is normal, but as soon as they step foot to see me, their pressure is high. Yeah. So this patient, we don't give them medication. We know they have what they call white coat hypertension.
Is it because the doctor's bill? Why they go?
Well, it could be that also. So there are people like that. So their high blood pressure is because people's weight. They are so big, so huge, okay? And then their pressure is high. When they lose the weight and they change the diet, they don't eat too much salt, their pressure goes down. So their blood pressure is because people have a tumor.
Okay.
Okay. Some people, we have a gland on top of our kidneys. We call a suprarenal gland. Sometimes people have a tumor on that gland that produce a substance we call catecholamine, adrenaline. And then when it's too high, this tumor is always producing the catecholamine, so causing the blood pressure to be high. So this is what they call a secondary hypertension. So if we know this is what it is, when we operate that tumor, the blood pressure is gone. You shouldn't have any blood pressure again. There are people who have blood pressure because they have what they call a renal artery stenosis. Because in your kidneys, we got some arteries okay, and that bring blood to your kidneys, and that regulate your blood pressure. So if you have a stenosis, that means if that blood, the artery that bring the blood to your kidneys becomes small, and then the pressure inside your kidney become low, so your kidney think that you're having low blood pressure.
Wow.
So since your kidney think you're having pressure, it produces a hormone, okay, that we call renin, and then the renin convert another enzyme we call angiotensin. The angiotensin squeeze all the blood vessel in your body to increase your pressure. So if you have renal artery stenosis, this can increase your pressure. So to correct that, if you remove that stenosis, your pressure is gone. The blood pressure is gone because your kidney, the blood pressure in your kidney will be normal, and your kidney will behave normally. But if it's small, it says that there's not enough blood pressure inside the kidney. Produce the renin, convert the renin converts the angiotensin 1 to angiotensin 2, that squeeze all the blood vessels in your body, your pressure goes high.
How do you remove the stenosis?
So if most patient, when they go to the doctor, no matter how much medication the doctor give them, pressure is always high. Now the doctor will do some tests. He will test the level of adrenaline or in your blood. If it's high, or he'll check the level of renin in your blood. If it's high, or there's another hormone they call aldosterone, he will check that. If it's high, it's suggesting something is wrong. It's suggesting you that the kidney is producing these things. Then we do what they call an MRA to check the vessel of the kidneys. And the MRI will tell you one of the vessels there's a stenosis there. And then from that, you send them to a doctor, to a surgeon,
okay,
or radiologist to open that thing.
Okay.
So not all blood pressure is the same. So people think, I heard people say, oh, I can treat blood pressure. We give this natural remedy, it treats blood pressure.
Yeah.
But they don't know blood pressure is just one name. There's a different type of blood pressure.
Yeah.
What blood pressure are you treating? So that's why people think doctors don't believe in natural remedies. It's not that. Okay, you have to know, when you say blood pressure, they have many types of blood pressure. When you say, I give you this medication to kill blood pressure, is it because the patient has a tumor? This medication will remove the tumor? Or because of stenosis? You don't know. So that's why we cannot agree to everything somebody say, okay, I take that
medication,
or natural remedy, and it cures me. It may cure you, but there'll probably a reason that thing that give would not. If you had done something else, it would do the same thing.
What level do you think belief plays in the whole healing process?
Of course, belief has a lot of things to do. You see, as Christians, we should believe what the Bible says. Okay? But whenever something is scientific and the Bible doesn't say anything about it, so don't come with belief. You think you can convert a doctor? This is a belief. If the Bible says it, we believe it. This is the Bible says it. But the Bible doesn't mention it, but because of belief, this is what we believe. Because as Seventh-day Adventists, we believe in natural remedies. We believe in a lot of things. Okay? But we have no scientific basis for it. It's our belief. As a doctor, as a Christian doctor, okay, if the Bible says it, I believe it's 100%. But as a Christian doctor, if you tell me something, it's not from the Bible, it's because you believe it, I'm not going to tell you don't believe it. My point is trying to explain to you why I cannot 100% agree to what you say. Okay? That doesn't mean I'm against you. I'm against what you believe. But scientifically, I can tell you what you say does not really make much sense. For you to convince me, show me the proof, and I will believe it.
Well, in Jamaica, I grew up in Jamaica, and they used to say, believe kill and believe cure.
Exactly, yeah.
Right? And so I have a doctor friend who told me that many times he prescribed placebos.
Exactly.
For his patients, because once it's given by a patient to a doctor give somebody, they come and say, well, I have this, I have that, and you prescribe something. They believe that what they're getting from the doctor is going to actually cure them. And so it starts in the mind, because they believe it, that whatever you're prescribing is going to do the trick, and that takes over. And sometimes it's just saline water, it's just placebo, empty stuff.
Yes. Yeah. However, it's not all the diseases you can address like that.
Right. True.
Certain diseases that we know, if you cure it or not cure it, is not going to kill the person.
Right.
Then you can approach it that way.
Right.
But there are diseases, if you don't do the right thing, person will die.
Yes, they're going to die.
That's why you should. Yeah. Placebo, yes. Placebo is something, that's why in studies we use placebo.
Yeah.
To test medication. Okay, we got one group of patients, we give the real medication, and one group we don't give you anything but something that look like a medication,
right? And
then to see what the effect is. Sometime in the group of placebo, the patient respond, and the group of real medication is the same thing. So that's why, based on that, we can say this medication either work or doesn't work, because if the same effect happen in placebo and the medication, then we say maybe this medication doesn't work. Because the same effect that I got in placebo, I got in the medication also. So then we have what they call a statistical analysis to see, based on statistic, does the medication work or not? Okay? So that's why studies are made for. We study and we compare until we say, okay, definitely we sure this is what happened.
Is it possible for a medication to be prescribed to several patients and they do react to the same medication differently?
I don't get the question.
Is it possible for a doctor to prescribe a medication to several patients? For example, maybe a broad spectrum antibiotic or whatever, or maybe metformin or something, where you prescribe it to several patients and each patient process it differently. Is it possible?
Everybody is different. Everybody is different. That's why in studies also, sometimes when let's say you study 1,000 patients, okay, and then from 1,000, 700 react to the medication and 300 doesn't. So because there are other things that can your system is different, okay. Now we're going to see, when you see that, you have to do statistical analysis. Why is it that 700 of them respond and 300 does not? So we have to see. The other patient who did not respond, was there anything that prevent the medication from working the way it should be working? Okay? So yes, this happened. There are people who get metformin, it does wonder for them, and the others doesn't do anything. Okay?